is a nice small group. And what we decided previously was you should feel free to answer questions during the entire kind of session because given that there aren't a whole lot of us here, I think we can make it a little more accommodating for people if you have some questions to ask. My name is Monika Jones. I'm the founder of an organization called the Brain Recovery Project. We just changed our name to the Pediatric Epilepsy Surgery Foundation. And we serve the community of children who need some type of neurosurgery to treat their seizures. I'm really honored today to be moderating this session. First with Dr. Aria Fallah, who's the Director of Pediatric Epilepsy Surgery, Pediatric Neurosurgery at Children's Hospital. It's also my son's neurosurgeon, so I'm a little biased. And my dear friend Kate Cooper, who's an advocate. She also has a company called Language Arts, and she is an epilepsy surgery mom whose daughter had surgery at age 16?
17.
17.
Yep, 17.
So just a brief introduction. These are our kids. My son Henry there on the right has had a hemispherectomy, which is a procedure to remove one half of the brain. And that's him. A few months after his surgery, he had the surgery when he was 3 months old. Kate, do you want to talk a little bit about your daughter?
Sure. This is my daughter on the left, Virginia. She struggled with drug-resistant epilepsy for about 16 years, and we were told for a long time that she wasn't a surgery candidate, but we eventually found the focal point. So she had a laser ablation, which we can talk about more later, at the age of 17. It was on December 2nd, 2020, so she's coming up on 2 years completely seizure-free. And that's a picture of her on move-in day in college. So she was able to move away from home this year, which was big.
We wanted to talk a little bit about the journey. I know there are a lot of sessions today and tomorrow about epilepsy surgery and pre-surgical evaluations and all the different types of epilepsy surgeries that you can have for your kids. Today we wanted to talk about the journey, how it may be different for all of you depending on where your kids are, what kind of condition they have. We know that families first have to struggle with recognizing epilepsy, kind of coming to terms with the fact that your child has epilepsy, that it's drug resistant. You go through a searching process where you're trying to find the right doctors. And you might think surgery is a last resort, which is no longer the case and hasn't been for some time. Then you really realize that surgery might be the best option. And then you're giving back, which is sort of where Kate and I are in our journeys by advocating. Kate, do you want to talk a little bit about how you went through this searching process of finding the right doctors to treat your daughter?
Sure. So the recognition part of the journey for us was incredibly short. At 17 months one day, I just noticed Virginia making this strange face. It looked like a vomit reflex. And I sort of ran with her to the bathroom and nothing happened. But then she did it a few more times. And, the news was bad, but we had the great fortune of going straight from the pediatrician's office to the ER, to her having a seizure in front of the attending, to her having one in front of the neurologist. So the recognition happened incredibly quickly for us, but it took a long time to find the right doctor. And so for us, the very first person we saw, because he was affiliated with a hospital where we were, just wasn't a great listener, wasn't super respectful, didn't see us as partners, and we recognized that pretty quickly and moved on. And then we were with one doctor for a really long time, and he was great, but then as my daughter became older and missing school became harder, she didn't want to explain her absences to strangers. Academically, it was trickier. Then we moved to someone closer to home. So, even if you find someone great, over time, as your circumstances change or the child's circumstances change, then, you might be back on that path all over again. So it's a little bit iterative, I think, if you're on a long journey. Yeah.
Dr. Fallah, can you talk a little bit about, when families come to you as a neurosurgeon, where do you find them on their journey? Are they still kind of searching for information, or do they think that surgery is a last resort? How do you find them?
Yeah, we definitely see the spectrum. I will say a little bit biased where I'm at, because we're at a level 4, which is the highest level of complexity epilepsy center. So we usually see kids that have sort of either been seen at other hospitals, or they've sort of, the families, by the time I see them, have a lot of information. But we also see families every once in a while, a little bit earlier, that journey. And one thing, just to take a step back about epilepsy surgery, that you may not know, it may be interesting to you, that in medical school they actually don't teach a whole lot. A lot of physicians don't know about epilepsy surgery. So I trained in Canada, I went to one of the top schools in Canada, and we only had 1 day of education on epilepsy, a single day. And the only thing that was mentioned was medications. Here are some meds. That's it. Maybe that doesn't give you a lot of comfort, right? Because you're going to doctors, they know everything. But keep in mind, that's one of the things that we struggle with, is sort of just educating our own field that this is an option and it's not just medication, especially when it comes to children. So we do try to fight that, that mindset that epilepsy is surgery is the last resort, because for some of the kids, surgery is the best option. And and what actually, getting a little bit off topic, but what actually drew me to epilepsy surgery from all of neurosurgery is this is the one area in all of neurosurgery where you can make the biggest impact. So you're taking lifelong chronic conditions that are as serious as epilepsy and being able to, some cases, cure them completely, but in other cases, being able to drastically reduce the number of seizures is sort of one of the most rewarding aspects of neurosurgery. So, but at the same time, we still struggle to get neurologists and pediatricians and even other surgical colleagues to think about surgical options.
We were lucky. We knew our son would need surgery as soon as possible, and so he failed 5 meds by the time he was 2 months old, had to be put into a coma, and then at 3 months old had to have his brain removed. So when I think about this journey for so many families, it seems to be really long. For us, it was very quick because we knew quite quickly the treatment that he would need. One thing we wanted to talk about was just so much inaccurate information that comes at us as parents from other professionals about epilepsy surgery. Sometimes we may have a neurologist that dismisses surgery altogether and tells you, whatever you do, don't let a surgeon touch your child's brain. We know that the neurologist sometimes doesn't trust neurosurgery because they are still 2 different divisions in the same hospital. We want to make sure that you're working with a neurologist that's working closely with the neurosurgical team. Did you have any barriers like this where you felt like you were, getting inaccurate information from a neurologist about surgery early on?
We had sort of a mixed experience because we had some neurologists who, in fact, when Virginia was 8, so she failed a lot of drugs like Henry did, but over a more prolonged period of time. So by the time she was 8, the doctor was saying it's time to talk about surgery, and so we then, saw lots of different experts to try to get the imaging to localize the focal point for her seizures, and then we would do surgery, but we just couldn't find it. So I felt like the team was pointing us in the right direction early. We did have one doctor. We actually had a stereo EEG, which is a diagnostic surgery. We can talk more about later, but and that doctor said, yeah, she's not a candidate. And it felt like the end of the road because she was about to turn 18. We had to make a decision, and while we were still really very much in control, and we actually went to get another opinion, they repeated the SEEG, and we found out she actually was. So, it all came back to that partnership. I felt like there were some places where we were listened to a little bit better. And it wasn't so much that I don't think anybody was intentionally feeding us misinformation. It's nothing like that. But sometimes, it's easier for a team to be the second team. They know where the first team didn't find it, and so the second team can find it. So for us, it was just sort of a matter of keeping at it, and just trying to get as much information we could to make the best decision we could for her before she became legally an adult. But it definitely takes doing some research on your own and knowing what questions to ask. And then, again, any doctor who balks, and I hope you would agree with this, like any doctor who balks at a second opinion is probably not a doctor you should be seeing. Like, they should encourage you, like, yeah, talk to someone else that, that's helpful. And, most of them will say, don't tell me what the other person said, let me hear the case first. And then, they're really thoughtful. They really want to look at it with new eyes. So those are the people you're looking for. Yeah.
Can I just add something? So epilepsy surgery is a team sport. So and part of it is you basically need an all-star team, neurology, neuroradiology, neuropsych, neurosurgery, and you're only as good as your weakest link. So if you don't have, so for example, if you don't have a neuroradiologist who specializes in looking at scans for children with epilepsy, they're not going to find the abnormality. That team is unlikely to recommend surgery, or they shouldn't, because they don't really know where that seizure is coming from. So you kind of and the tough thing, I'm in the field, so I know, but as a parent, it's hard, because what do you go by? I mean, you go by U.S. News, rankings. I don't know. You look at how many billboards a hospital has in your area, or how So and that's not going to give you the information that's relevant, because you're talking about a very highly specialized field. I would recommend connecting with organizations such as Monika's, and speaking to other families, especially if you have a rare diagnosis, because you're going to find these Facebook groups to be much more valuable than your Google searches. Mm-hmm. And they are the folks to talk to that can help you even sort of select out a team. Where do you go? Where do you get this information? Because and you may be situated right next to a world-class hospital, or you may be far away from a place and you need to travel to get to a place that can do this type of workup.
Maybe I'll just ask a quick question to the audience. Has anyone have you had the experience where a neurologist has told you don't even think about neurosurgery, or don't even go there? Can you share your story real quick? Real quick, I know you, so real quick.
I'm Monika's colleague, so we're like she's my work husband. So my son, who ended up having a hemispectomy, he had infantile spasms, which is a very catastrophic form of epilepsy, and he had a massive stroke in utero. And for about a year and a half, our level 4 major medical center told us, wouldn't let us even think about surgery. And thankfully, we had seen another neurologist that ended up going to the Mayo Clinic, and they were doing some testing there that they didn't have available at our local hospitals. And he said, why don't you come here? And we went there, and ultimately they did just an overnight video EEG and saw it seizing all from one side, and he had a massive stroke, and they were like, we're going to do a hemispectomy. He didn't need further testing. But it was a year and a half of us watching our kids seize 200-300 times a day, and the team telling us, no, we're not going to talk about surgery. The head of the department at the time said, oh, there's still a lot of good brain left. So that's the quote that sticks with me.
Monika.
He's in college now, right?
He's in college, yeah. He's passing.
There's a woman in the back, too, another one.
Yes.
So we're from the Midwest, and we saw a team in the northern central part of the U.S., and our neurologist at the time, we were 12 drugs in.
12 drugs in.
With my child that was like 19 months old.
Wow.
So, and throughout that whole process, actually, we had never been given a surgical option. And actually, it was an email from you guys in November to celebrate Epilepsy Awareness Month. And it's by Luke Tomer.
So the videos.
The video is epilepsy surgery for you, and to not put it at the bottom of the list, to not say that it's your last line defense. And so we went to our appointment the next month in December, and our neurologist at the time looked at me and said, well, Liz, you can't change his chromosomes. So it's basically you're screwed. And I said, I'm not trying to change his chromosomes. I just want to give him the best chance at what I can give him. That's my job as his mother. He was like, well, then you can come up here and you can just do a VNS and that'll be it. And I was like, okay, well, who of the team do you work with the most? Because I also work in the medical field, and I know, like Dr. Fallah said, that teams work together. And who are the players on your team? And he said, I would just recommend anyone on the team. And I was like, that it just didn't sit well with me. Mm-hmm. So we said we got our own options, and we had a really great option.
Oh, you're sitting here. Wow, that's a powerful story, and I'm glad that we were able to help. But I think that this ongoing theme of having professionals that you think are supposed to be reliable all the time telling you that something is a last resort is definitely something that's not true today. Sometimes we as parents can be our own worst enemy when it comes to epilepsy surgery. We think of epilepsy as being a disease that's treated by medication, not by surgery. I myself, when they first told me your baby needs half his brain removed, I thought they were crazy because I'd always thought you just pop a pill and it treats her seizures. I read this one paper that says that parents think the death rate during surgery is 55%. It's actually far below 1%, which is about the same as a tonsillectomy. And what we don't look at is a lifetime of uncontrolled seizures, what that can do to a child. Kate, how did you go from thinking about medication to surgery as an option for your daughter?
I touched on this a little bit, but for us, luckily we had a doctor who early on just said, look, she's failed 6 drugs. They aren't chemically very different. He does a lot of research with the NIH. He said there's nothing coming down the pipeline that's very different. It's time to think about surgery. And it really, I don't know what this says about me, but that wasn't a huge leap for me. I mean, it made perfect sense to me that, yes, there's some abnormality, and if we can find it, then that's our best hope, So that, it wasn't a hard leap for me. And then by the time, and again, that was when she was 8. So even at that point, it seemed like the next logical step, and it wasn't until when she was 17 that we did it, and people kept saying, aren't you so scared, aren't you so scared? And I thought, every day is so scary. This surgery is hope. It was nothing compared to just what we were living with constantly, and how, she just wasn't able to live up to her full potential. Whatever that full potential might be, she couldn't do it. So for me, it was an act of love, but it was also an act of desperation. And I could wrap my head around it pretty quickly. So.
How do you help parents cope with this fear of surgery? How do you kind of walk them through the process, Dr. Fallah?
Yeah, I mean, it's tough because it's a I look at these numbers, right? I fully agree. I mean, let's talk about death for a second. 0.6% seems low, but if you're in that 0.6%, that's 100% for you, right? So you never want to minimize that. But I can give families comfort in letting them know, first of all, this has been around for over 100 years. This is not something new. So even though your local doctor may not know about it, we're not doing experimental things. This is really well established, and especially at centers around the country that have been doing this for a long time. It's, so for me, that's not happened to a single patient. I've operated over 2,000 patients right now. So not to say it can never happen. There's always a possibility, but if you go to places that have been doing this for a while, you can have comfort in knowing that these complications are exceedingly rare. But I also think it's important to talk about that third point you have up there, right? What are the risks of not doing anything? And those risks are maybe not high on a day-to-day level, but for months and years of uncontrolled epilepsy, those risks add up. There's risks to medication. We don't know what these medications do to the growing, developing brain of a child. They're really made to slow down the brain. That's how a lot of them work. Where the field is moving towards earlier and earlier surgery, to the point where we're now having discussions. It's not there yet. It's not prime time yet, but we're talking about, what about failure of just one medication? What if, should we do surgery on a child who's not having seizures, but developmentally they're stagnant or they're regressing, and we know that there's abnormal electricity. So those are the conversations we're having internally as a field. I suspect at some point we're going to go towards that. Right now, it's still, the recommendation is still failing 2 meds. But our job as physicians, as healthcare providers, is to advocate for each and every child, because ultimately what we want is to get every child to their full capacity, whatever that is, right? And for some patients it's going to be seizure freedom, for some it's going to be seizure reduction, but that's a very important part of what we do.
And just another thought, if I can add on that. So when you think about any surgery, right, or any big medical thing you're doing, you have to weigh the risks and the benefits, right? That's the calculus that we as caregivers are constantly doing. But you can't do that math if you haven't at least done the evaluation. And so, for me, I felt like even at the end of the road, this is yet another dead end. I can go to bed every night saying, we did all the research. How do you know? You can't weigh the benefits and risks until you've actually gone down this path, done the imaging, found out what the risks are for your particular child. So, as big and scary and this dark cloud in your peripheral vision of surgery, it might be a darker cloud than it is. It might be a lighter cloud, but you have to kind of go through the steps in the evaluation before you can even talk benefits and risk. So I think that's really important.
Social barriers, this is one that really breaks my heart, but one of the things that we know that keeps kids from surgery is socioeconomic status of the family can keep them away from surgery. Kids who have Medicaid, for example, get surgery later. Travel costs, just traveling to a hospital and doing EEGs and MRI can get very expensive. And unfortunately, race. So white children tend to have surgery, 69% of them. Who have surgery, or of the kids who have surgery, 69% are white. Latinos down to 9 or 7%. How quickly did your daughter get to surgery you have private insurance, I know we've talked about that. Mm-hmm. Did you have any problems with the insurance company getting approvals and all that for surgery?
Our insurance company moved pretty quickly. The one point I will say on this is don't make assumptions. Like, don't assume that, an MEG won't be covered or that your deductible is higher than it is. Like, actually go through have the doctor send the diagnosis codes, actually find out what's going to be covered before you decide. And if they reject you initially, just refile it again. I know that sounds silly, but sometimes they say no, and then the doctor refiles it, and then they're like, yep. And you're like, okay. So don't give up on that, and don't assume it's going to be insanely expensive. I think in the end, our daughter's surgery cost us a few $1,000s, which is a ton of money. But we're also not driving hours and hours to the neurologist anymore. I'm not missing work all the time anymore. You have to, again, you can't really do the math until you know what the math is. So, don't assume you won't be covered. You might actually be surprised at what is and isn't.
Go ahead, yeah.
Go ahead.
No, I was going to say, how do you work with, I know sometimes the insurance will just deny a surgery outright. How much of a headache is that?
Yeah, that's a big headache. I mean, I'm trained in Canada. We don't have insurance denials. Just kind of whatever's needed gets done. But so it's
how refreshing.
It's a new thing. But usually I have to get on the phone with a general pediatrician who doesn't treat epilepsy and convince them that this is necessary. So this is a new thing for me. It can be a problem. California, I think we have a lot of level 4 epilepsy centers. So this is a place in the country that sort of has a lot of resources. But depending on where you are, so for example, Nevada, there's no pediatric epilepsy surgeon there. There's no one can get epilepsy surgery there for their child. So if you're in that state, what you need to do is, if you can, switch insurances to go elsewhere. If you can't, you have to speak to that local, your insurance, to say, look, these are services you cannot offer. You need to send me out somewhere else. And that is a journey. That's hard. But I will tell you, based on experiences, most insurance companies do not want to get between a parent and their child. And if you advocate strongly and passionately enough, and with the help of organizations that can prove to them why this is necessary, I don't want to say all the time, but most of the time, you'll hopefully get to a place where they can treat your child. We do see still, unfortunately, sometimes folks even in California, they have a certain insurance company and they have to wait till their open enrollment to switch to something else that they can go to a different center. The physician team, the medical team, we always like to advocate for your child. but it's going to take, the parents too to advocate for your child, to get those opinions. And I fully agree with what you said earlier. Get an opinion. It doesn't mean you need to have surgery, right? And I hear this a lot. There's families that, I don't want to do anything to my child's brain. That sounds super invasive, right? VNS I'm okay with, but nothing in the head. I say just get the opinion. You don't have to do it. You don't have to, you're not signing them up for surgery at that point, but get the information, because you don't want to find out 5 or 10 years from now about something that you wanted to do before. And then that just reminds me of something else. I don't want to say all the experiences are rosy. Sometimes there's children that have had surgery and have seizures, right? And fortunately, it's the minority. The majority of patients that undergo this have a good outcome that they're happy with. And if you talk to those families, almost universally what you're going to hear is, I wish we did this sooner. And that's a common thing that I've noticed, and obviously we have parents here that can attest to that or disagree with me, but that's one thing that's really important, especially in childhood. Adult epilepsy, which is the majority of what you're going to find in terms of information, if you ever Google epilepsy, it's temporal lobe epilepsy in adults. It's very different. When we're talking about children, time is brain. And the sooner we get the seizures under control, the sooner we can improve other aspects of
Yeah, and just to add on to that, without doing the research, the surgical evaluation, you also don't know which surgery you're even thinking about. Because we were told for a long time that our daughter would have to have a craniotomy. We were told they'd even have to place grids on her brain just to evaluate her. Well, it turns out her brain surgery was one little hole here and one little hole here. I mean, we've gotten more stitches at a birthday party. It was like, and she was in and out in 2.5 hours. And again, that's one person's story, but what we ended up with was very different than what people told us we were even looking at until we, asked those questions and pushed for the answers. So the information is power, and time is brain.
Yeah. I'll just interject a little bit here. I do think that when you are making the decision of not even attempting surgery, not even exploring it, that you are making a decision about touching your child's brain, because you're not even opening that toolbox of surgery to see what's inside. Because we're scared as parents of surgery, it's natural. But you are in fact making a decision by not acting, because the seizures are going to continue with the medication. I'm going to stick my neck out a little bit here, which I know is rare for me to do. Just because a facility is a level 4 does not mean that they all have the same experience. The trickier the surgery, the more complex the condition, the more experienced your team needs to be. So especially in a state like California, when you've got 14 facilities to choose from, do your research. Research the surgeon, research the team. Just because they're a level 4, it does not mean that the expertise is the same in between all of them. The more complicated the surgery, you've got to start doing your research. Because sometimes the insurance companies may not want to allow you to refer to another level 4 because you have someone in your area who is, and you have to be able to say, but they don't have the experience in this procedure that this other hospital does. So it's really important to do your research there. Does anybody have any questions as we move on to the next? We've got some time. Sure.
Just also, like, if there's a specific procedure that's being considered, instead of just saying, oh, I want to know if this particular surgery is safe, what the outcomes are, you want to ask the surgeon, how many of these have you done, and what are your outcomes? And you might not get the answer, but if you're not getting the answer, that's also kind of raises some red flags. And, like, I know for a hemispectomy, I want to go to the person who's done a lot of hemispectomies. If I'm going to get a laser ablation, I want to say, goes to someone who does 40, 50, 60 laser ablations a year. Like really high volume, and there are only 15 maybe in the country that are really that.
If you can get there,
if you can
overcome those other barriers.
So we do have a surgical evaluation trauma scholarships that helps a little bit.
I think this is our last slide. One of the things that can keep you from surgery is just how complicated the surgical evaluation process is. It's not easy. For some of us, for me, it was pretty easy. We just had an MRI. They said, oh my God, one side of his brain is huge. We have to take it out.
that was easy. For you, it was a little bit trickier. We can have multiple hospital admissions, scheduling issues, insurance authorizations, wait times, all that kind of stuff. Can you walk us through a little bit, just kind of what a nightmare that process was for you?
I said a lot about this, so I don't want to be too redundant. I think the biggest thing for us, and it's important to keep in mind, was between the time when my daughter was 8, that was 2011, and she was 17 in 2020, a lot of what changed in that time was honestly the technology. Better imaging. You think about where cloud computing had gone in that time. We're able to analyze gigantic sets of data now that we weren't able to before, or more easily we can analyze them now. So, the evolution of epilepsy surgery has largely paralleled, the evolution of the technology that supports these evaluations and the surgery itself. So I throw that out to say, if somebody told you 4, 5, 10 years ago you're not a candidate, like this is something you should revisit with time. So that's one quick thought. In terms of the complexity of our pre-surgical evaluation, our experience really echoes the sentiment that Monika shared, that kind of not all level 4 epilepsy centers are created the same. So she had the same diagnostic surgery in 2 different places, as I said, and they had very different opinions on what the answer was. So that was the hardest part, is sort of like, my husband and I always joke, we could see 10 neurologists and hear 10 different opinions, and then I, the history major, and he, the government major, we're like, we're going to listen to you. And we'll try that for a while, and then we're going to listen to you. So for me, the red flags were, a doctor who wasn't interested, was against a second opinion, or a doctor who shot down my questions without answering them well, or just didn't listen to me well. I kept asking my doctor to explain stuff, and he would explain it, and then I would try to repeat it back to him. I'm a plain language expert. It's what I do for a living. So I would repeat it back, and he'd say, that was very well said. And I was like, yes, try that yourself next time. Like, he couldn't even explain things to me. And I thought, if you can't explain it to me, it was very dismissive, and I kept trying to tease things out of him. And ultimately, that wasn't my partner, right? So for the complexity for us was finding the right partner. I wish that we had found them sooner. I want to kick myself for that, but we tried. I mean, it wasn't for lack of trying. And it was just incredibly, incredibly hard. So I would say, as a caregiver, even if you have insurance, even if you have the means to travel, this is a long road, and you have to think about how you can support yourself. Like, is there someone who can come and stay one night and give you a break? Is there a way you can divide it up? Does the hospital have a Ronald McDonald House where they can help you? Do they have social workers on staff who can come and hold your seizing baby so you can take a shower for 10 minutes? We've all heard it. It's a marathon, not a sprint. So ask what those resources are. And if a place is withholding them, maybe talk to someone else. It takes a long time. Mm-hmm. So.
And I was just going to say,
of course.
Monika, I think you know this data, but what's the average length of time that someone goes from the time of drug-resistant epilepsy to having surgery in the adult and children?
There are some adults that have waited 20 years.
Yeah, so 22 years in the adult population. The folks that are getting surgery as an adult, when you look back, on average, they've had 22 years of drug-resistant seizures dating back to when they were a child. And in the pediatric population, it's something lower, but 5 years.
Can you talk a little bit about how you, as a neurosurgeon, try to fix this evaluation process? Like, what are you doing at UCLA to make this less complex? Because it is a big headache for families when they start looking at surgery and then they go, oh my gosh, look at all these tests. I have to fly here, I have to fly there. What are you doing?
Yeah, we're lucky in a place where I work in a place where we have a lot of resources. So almost, I want to say, all these tests, maybe perhaps other than MEG, our patients go to UCSF for MEG because we like their MEG up there. But other than that, all of it can be done just at UCLA. And we're working hard to try to minimize the number of days a child is there for the evaluation. So, just working on something where your child comes in Monday, we get the MRI, the PET scan, the EEG, we have our discussion on the Wednesday, that's when our meeting is, and, for some of these families that are flying to us from further away or driving to us to have the surgery on Friday. So try to package as much of this together on one admission as possible. It's not easy. We have bed shortages. I mean, I also work, the downside of working at a big hospital like that is we run at 110% capacity. So it's hard to find beds. So, but the other thing is there's a lot of programs that also have a nurse navigator that are going to help you through that process. This is complex enough for, if our residents don't even know, all the steps required for epilepsy surgery. So let alone as a parent here trying to figure this out on the fly. So I think it really helps a lot of programs have nurse navigators, I should say, that help you navigate this process. What is this next test? What is a WADA? What is it going to tell me about my, the epilepsy and so on, to try to make this. But I will say, despite that, you have to be persistent. You need to follow up, and keep in mind the surgical team, the epilepsy team, they're super busy. So if they don't hear from you, or if you don't call them in a while, and you just kind of let things, you just wait on them to call you. Sometimes, we have patients falling through the cracks, and suddenly, someone will tell you, "Oh, I wish we did this a year ago or 2 years ago," and what happened. So the system's not perfect, but we need you to advocate for your child just as much as we are trying to on our side. We also have our hands full with, think of a hospital system. I can advocate as much as I want for our patients with epilepsy, but we also have the cardiac surgeon and the rheumatologist and the orthopedic surgeon, and each one is sort of advocating in their own domain. So we kind of need to work together.
Just a shameless plug for our organization. We do have a travel scholarship. If you need to travel more than 50 miles to get a surgical evaluation for your child, we give you up to $1,000 if you qualify financially. So that can get you the hotel room and food and all that you need for the evaluation. We finished kind of early. Does anyone have questions? This is a really nice opportunity to get to ask the surgeon whatever you want.
Yeah.
My daughter has LGS. Is that something that she can be? I remember in the very beginning, they did tell us because she transitioned to LGS, that she wouldn't be a candidate for surgery. But again, that was when she was 5.
So I will get another opinion. So we are now, and things are so rapidly changing. If I've been here every year, last several years. If you were to ask me a few years ago, I'd say no. But the answer now is yes, because now with the new tools, especially the neuromodulation tools, we didn't get into that much, but not only VNS, but now DBS and RNS, almost everyone is a surgical candidate. And it may not be curative. So in LGS, it's hard to do a curative operation, but we can do an operation. Usually doesn't involve removing any brain. It usually involves implanting a stimulator, where we can vastly reduce the number of seizures and perhaps lower the other medications that may be causing side effects and so on. So we now do have options. Some of this is not on label, meaning it takes, to do the studies, the big studies in children, it's always very difficult because children cannot consent to their own treatment. So a lot of what we see in the epilepsy world, especially when it comes to devices, is the studies are done in adults, they work in adults, and then there's no reason to think they don't work in kids. You just use them off-label in children until enough time has passed and it becomes on-label. So that's usually the way things work. But yeah, I would say almost anyone, unless perhaps some rare genetic disorders we would still not consider a surgery for, but almost everyone else right now, there's something we can offer. But let me add to that, one more thing.
Of course.
But it also depends on where you go. So there will be centers that will just be doing, centers that are pushing the envelope, and then there's centers that are just going to wait until that data is out there and you have that FDA approval and so on. And unfortunately, that's the careful, more conservative route. I shouldn't say careful, but more conservative route. But also keep in mind your child is losing cognition and other milestones with repeated seizures. So that's sort of a risk balance that you have to risk balance. You know, you got to weigh those risks yourself. Any other questions?
Any other questions? All right. Thank you. That was quick.
It was.
Yeah.
Nice.
Thanks so much.
Thanks, everybody.